the pairs with the hearing aid. I will move on to the next 2-3 more pages we have, and on that is the formula everyone should know. They're asking, can you do some review on calculation next week?
Yeah.
Okay, so bring something, and those who are here, we can do some calculation because I'll be done taping. So calculation, IV and calculation. Next is on-call medication, PRN. Patient is in pain. You must give within 5 minutes your medication. Next is, next line, culture and spiritual needs is very important for your patient. Ask them, what do they want according to their culture? So next page, drug question, first line, second question, underline 5 minutes, you make sure you give your patient. Then critical pathways, underline the word, these are very important, and multidisciplinary guideline. Everybody get involved, and critical pathways for your patient care. So nowadays, when we are doing a patient care, we are doing critical pathways. Prioritizing your nursing diagnosis should be with the problem. So remember, diagnosing. Priority is your diagnosis for your patient. And then problem associated with airway and breathing would be, and circulation is important. 2 nursing diagnoses what are 2 nursing diagnoses are important? Second line, airway, ineffective airway, and also ineffective breathing. Ineffective means they cannot breathe. Ineffective airway, they cannot get air. Sitz bath is important for pain. Which patient after rectal surgery? Write down is episiotomy question. You give sitz bath, write down on sitz bath, next page. Sitz bath, I finished already 4 or 5 lines, and it says subjective sign that a sitz bath has been effective, decreases pain, and write down swelling, and also inflammation. And which patient do you give sitz bath? Write down episiotomy, and after mother has episiotomy. And don't give sitz bath before 24 hours. After episiotomy, after 24 hours. Before 24 hours, you apply ice. So write down the word ice. Yeah, before 24 hours, ice. First 24 hours, ice. After 24 hours, you go sitz bath. Rectal surgery, you can go for sitz. So remember, what is a sitz bath? Do you know what is a sitz bath? You let your patient sit on the warm water, and they have a special kind of container you can attach on the toilet seat, and when they're sitting, they can get like a warm compress. Are we clear? With the water, with the warm water. Next is nursing diagnosis. Diversional activity is, what is diversional activity? You give second line when your patient is bored. I'm getting bored. Give them something to do because they have nothing to do, and give them diversional. Let them watch TV, take them in activity. Most appropriate diagnosis for patient who cannot speak English, impaired verbal communication. Your diagnosis would be impaired verbal because they cannot understand, they cannot speak English. So if somebody cannot speak English, you will write down the nursing diagnosis, impaired verbal communication. Next is hearing impairment patient. If your patient cannot hear, always face the individual when you are speaking to him. Call them by name before you touch them. You go in the room and face them. Next is hearing impaired should face the individual before putting eye drops. Underline the word child up to age 3. You pull pinna down and back. After 3, you pull pinna up and back. Are we clear? Not down, up. So adult and more than 3 years. So up till 3 years of age, you will go down and back. So if they're going to give child is less than 3 years, then you do this. Then before you're putting eardrops, how do you, you will go. To prevent eye drops injury, should waste few drops and instill the drug in underlying conjunctival sac. Where are you instilling the drops in conjunctival sac? And then you will go, when nurse remove gloves, soiled gloves are, first remove the gloves. I don't know if you have it, you can take this. Yeah, so remove the gloves and discard it. So remove the first gloves. I want you to go into, so down pinna, eye ointment, we already talked about it, and gloves. Crutches, how far do you keep the crutches? Very important. 6 inches to the type and from the tripod arrangement. So when they're going like this, you put 6 inches to the side. You have to go, show her where you are. And 6 inches on the side. Listening, very important in your communication. Always don't explain. Always you don't talk. What do? Listen. Especially when is good listening. When your patient is having a bad diagnosis and they're talking about death and dying, let them family and people talk. A lot of time listening from your patient is better than you give advice. Before teaching, nurse assess patient knowledge and willing to learn in your patient teaching. Are they willing to learn? What knowledge do they already have? Then you start teaching. Next is recording is a method. Communication is process. Recording is a method of communication. Underline the word recording. What does recording means? Charting. When you chart, somebody can read what you have done. So charting is a communication between the staff and the doctors, right? So charting is a communication. So you must chart clear, legible, people can read, and that would be in communication for your patient. Teaching the procedure we already did, and elderly patient, limit high carb diet because increasing the risk of glucose intolerance. So what is carb is? More carb is sugar. It increases what carb? Your glucose. Are we clear? So don't give them a lot. When feeding elderly patient, don't let them eat essential food. Don't give ice cream first. Let them eat protein. Are we clear? So let them eat a proper meal. Passive rate, what is passive? The nurse does the exercise. Active patient does. Passive, write down the nurse. And what are you doing? Mobility work, you're moving joints. If your question is resistive exercise, increase muscle mass. So what is resistive exercise? Increasing the muscle mass. So if patient is not moving, what happened? You become contracted. Are we clear? So increasing mass, write down the word contracture. What is contractures are? In your question, shortening of the muscle. Muscle becomes short. So write down the word contractures, and write down the word is muscles are getting shorter. Shortening of the muscle is your contracture. So you give range of motion. There is a active and passive. Active means patient is doing. Passive means when nurse is doing. Isometric exercise I did earlier. What is isometric exercise? Contraction of the muscle, heart muscle, abdomen muscle, thigh muscle, in which underline cast, word your patient has cast, traction, or rheumatoid arthritis, and excavation. When your patient says, I cannot move, joints, what exercise? Don't stop. Don't pick up the answer, stop exercise. What do? Isometric exercise. Your patient has excavation of rheumatoid arthritis. They're having a lot of pain. What do? Is continue isometric. Back rub. Control your pain. Why? Gait control therapy. What is another thing we give for pain? Tense unit. But what is a back rub? Relaxation. So pain medication, instead of pain medication, give a back rub. Why? Because it controls the pain. And what the gait is controlling? Pain gait. Anything below, now this is very important, below the waist is considered unsterile. Are we clear? So when you're doing it, keep it at the level of your waist, your dressings. Are we clear? Below the waist would be unsterile. And sterile field monitor become unsterile when they come in contact with unsterile. If you're wearing unsterile gloves and you are touching a sterile, they're contaminated. If you drop water, wet, contaminated, you cannot use it. Very important. Around 1 inch area, keep them a sterile field, around 1 inch area. Now you know how you remove the package of your thing when you're opening a sterile package? They're packed. So you are opening the first package, goes away. Second part goes like this. Third part comes towards you. Are we clear? So it's a package. You open like this, open the last one. Any question, you drop water, wet, contaminated. You touch unsterile, contaminated. Around 1 inch area, keep them what? Sterile. Do not pour water from contaminated. What do? Don't touch the bottle. You open before. If you open now after wearing sterile glove, you become contaminated. Sometimes your questions are going to be a sterile technique. How do you remove dirty dressing? With unsterile gloves. Are we clear? And you throw it away. Take out the unsterile glove. Then once you open the package, you're wearing sterile glove, then you're not touching anything unsterile. Are we clear? So make sure you guys know sterile and unsterile. Next is shifting to the left. Underline. Immature cell is increasing. Blood increases to fight infection. Shifting to the left side. Immature cell increasing, they're fighting to infection. Right side, immature cell in liver disease and pernicious anemia. Sometimes they use the word shifting of the cell and shifting on the right side, they're going in there. Now I will be moving on to the next page. When blood pressure in neonate, cuff size. Make sure the cuff size according and 1/2, no more than 2/3 of the length of the extremity that is used. So select the cuff size. No less than 1/2 and no more than 2/3 is covering. Z-Track injection. How do you give? IM. Why do you give? And to prevent, underline the word staining of the skin and write down irritation. Next is intradermal. Where do you give intradermal? What do you give intradermal? Insulin. You give heparin. You can give them on the upper chest. You can give them on the back, shoulder, under the shoulder. You can give them on thigh. You can give them on abdomen. So inner arm, upper chest, you can give back. But very common, you give abdomen and thigh. Next is answer in examination is correct, and you should consider whether action describe autonomy. Underline the word autonomy. What is autonomy? Independence. Let your patient make decision freely. Increasing self-esteem. Increasing self-belonging. You all want freedom, right? You don't want somebody tell you what to do. So what do you want for your patient? Remember the word autonomy. And independency, self-esteem, and increasing self-belonging. When answering NCLEX question and underline stimulus through thought, interfere the thought and determine whether interference is correct. When is doubt, the nurse should select an answer, indicate need for further information. If you're not clear, underline that. Chest pain. And the nurse interfere having cardiac pain. So chest pain, having a cardiac pain, in case the nurse hasn't confirmed, pain is a cardiac, appropriate, make further assessment. So pain, cardiac pain, chest pain, assess. If you don't know, then you make sure you are assessing the right thing. That's what they're talking. Next is the truth is essential component, therapeutic relationship between healthcare provider and the patient. What kind of relationship we have? Therapeutic, and write down professional. We should be professional. Don't get personal. I can do shopping for you. I can take you to church. Are we clear? I can take you out for lunch. You are getting too personal. And so remember, therapeutic, professional, good word to answer. Beneficial is the duty, no harm on duty is good. There is obligation for care, underline no harm, equal obligation to assist your patient. You assist your patient equally. Don't be favoritism. And don't spend much time with one and don't give time to others. Now, some patients require a little more because of the care is different. But you got to consider, number one, safety and perfect what you need to do on your job. Next is non-malicience is the duty, do not harm. Non-malicience means no harm. Don't give any harm. You provide your care without harm. A, B, C, D, underline that. A, airway. Check for airway. Could be allergies, airway, underline third line. Allergies can cause airway problem. B, breathing can cause hypoventilation word. Hyperventilation, abnormal breathing, giant stroke breathing, circulation, assess in fluid, circulation means fluid, and electrolytes affecting the heart, disease process. So A, B, C, D, first you go airway, breathing, circulation, then you look what is the disease process your patient has. Underline the last line. If your patient has cancer, hypoglycemia is immediate concern. You got to give something. A means everything else, including your written incident report, chart. So remember what they're saying, A, B, C, D, E is important for your framework for prioritizing. That's a priority. Go airway, breathing, circulation, disease process, and then other thing, whatever you have to do, incident report. Then I will skip that, and answering question in NCLEX basic rule is assess before action. Then you go usually several answer reflects implementation. Now don't apply before you assess. So remember, what do you do before? Assess, then do implementation. Then you skip. Next is greatest good for the greatest number of people is utilitarian word. Egalitarian theory is also assess good services must be provided to the less formulated and by efficient or affluent society. Active months is actively helping the patient. Now these are some of the wording in the question can be. The next page, nitrogen base, question are protein. Which people do you cut down protein? Which patient do we cut down protein? Renal and liver cirrhosis. Write down there liver cirrhosis and renal. Absorption of your food. Where does it take place of water? Underline large intestine. Write down where does your food is absorbed? In small intestine. So write down the small intestine, you're absorbing food. Large intestine, you're absorbing the water. Okay? Assessing of your eating habits. Have you eaten in the last 24 hours? Patient comes to the hospital. Any question? When did they eat last? Maybe a problem in eating. Maybe they're not eating. Vegan diet, fiber. Vegan diet is a fiber. I gave you a page of diet. I want everyone to know through your vegetarian diet. If you don't have, ask me. I'll give you after I finish, okay? Hypotonic enema is given to stimulate peristalsis. Underline the word soften the feces. It soften the feces. First morning specimen, early specimen is good for glucose, ketones, pH, and specific gravity. Sleep is the first minimize, underline the word minimize environmental stimuli, quiet environment. Don't pick up the sleeping pill first. What do you look? No noise. What happened in the night time? We talk, nurses, and we make a lot of noises. Some patients complain. So quiet, maybe roommate is noisy. Are we clear? So first thing before you pick up, and also write down relaxation technique before you go and sleep. Relaxation technique. Back rub. Maybe activities so they can sleep better. Okay? Any answer. Don't pick up your answer drugs. Pick up your answer what can be more better for your patient. Next is to lose 1 pound in a week. Decrease his weekly intake 3,500 calories and lose 2 pounds in a week. The patient must decrease weekly calories about 7,000 calories. Are we clear? Can you pass it to her and this page and tell her where we are?
Is it the same one, Rose?
No. Okay, so when you are losing your weight, is how many calories are there? Underline the word avoid sharing. Avoid sharing. So go from the back, is 2 pages, only 2 more pages, okay? We have finished that. So remember, what is sharing? Rubbing of the skin. When you leave your patient, don't let them slide. Why? What will happen? They're going to be more sharing of the skin. So prevent that, your patient sharing of the skin. Then I want you to underline the word is catheter. Through the nose, take careful suction. Nurse should ask the patient to swallow. When you are inserting the catheter in the tube, they can swallow. NG tube, same thing. Vitamin C is good for collagen. Underline the word wound care. When you are giving wound care, wound healing is good. Pain, assess the pain. Cutaneous stimulation, release endorphin. Cutaneous stimulation, release endorphin. Write down TENS unit. TENS unit for pain. So how does the TENS unit work? Is stimulation of cutaneous and endorphin for pain. That's a pain management. You don't give medication, you can use that. Next is on your patient with, we did cutaneous pain control analgesis, PCA pump. Underline acute pain. You can give for acute, after surgery, traumatic injury, labor, delivery, and cancer. Patient control. What is in the PCA pump? What we have in PCA pump? Pain medication. And what is pain medication? You monitor respiration. Write down CNS depression and constipation. 3 things, side effect. Patient is on PCA pump. What do you monitor your patient for PCA pump? Number 1, respiration. It lowers the respiration, depress the central nervous system, and also constipation. So underline that. Patient can control and count the doses. As a nurse, what do you do if you have a PCA pump? Count the dosage. Are we clear? Count the dosage. Next is, I will move culture in communication, distance between others, Asian, European, American. They don't communicate very clearly. They keep the distance. So remember, culture is very important. Patient who believes scientifically and biomedical approach to health is likely to take drugs and treatment. That is scientifically. Now, we treat ourselves with herbal medication. Are we clear? Scientific, whatever the doctor has ordered. So remember, a lot of drug you cannot give with herbal medication. That's why in NCLEX, all these packages, you have a lot of herbal medication. You must know some of them. And because some of them you cannot take with the blood thinner medication. Are we clear? Like garlic, I said, and also you have some of the other drugs, and we have done other packages. So you got to know, culture is important for NCLEX, your herbal medication to know, and your regular medications are. Next is, I will move on, patient belief that we did already, is chronic illness is people are maybe older people. What is chronic? Write down chronic illness. Chronic pain does not change his vital sign. Chronic means you have that disease for a long time, you're living. A lot of your older patients, heart problem, diabetic problem, kidney problem, chronic. Chronic illness states preference about daily life. Next line. And treatment decision. So what happens? You get tired of being sick. Are we clear? So what do you ask them? Cause patient to seek treatment, and also ask them what do they really want to do it. Because it's very hard when you become everyday sick. And preference, daily life and activity and treatment decision, because you're chronic ill. You get tired and you give choices. Excavation of chronic disease usually cause patient to seek treatment. Remember, a lot of disease never goes away. Underline word excavation. Excavation, they become very acute. They were chronic, but they become acute. For example, write down the word multiple sclerosis, rheumatoid arthritis patients. Are we clear? And lupus patients, they're chronic, but they flares up. They become what? Bad. They become acute. That is called the disease. Now, a school health program, cost effective, low income people, very important for low income people. I want you to write, how do you prevent diseases? Immunization. Make sure the parents are getting correct immunization to prevent they become sick. Next is promotion of collaboration, development, independence among members of profession. We got to collaborate, we work together, and independency as a professional we need to do. Changes agent individual who recognize need for changes, selected to make a changes within established and such as in the hospital. Remember, change agent is individual who recognize need for change. Changing agent means you're changing your way of your treatment. You're changing maybe a doctor. Some people, do you have right to change? Yes. When you see something is not working, people do want to change. Bill of Right. Patient's Bill of Right comes under what? American Association. Write down Bill of Rights you give on admission. When your patient comes, let them know Bill of Rights. Abandonment, termination, abandonment, premature termination of treatment without patient's permission, without appropriate relief of symptom. Don't abandon any treatment without. Don't walk out from your job. What did you do? Abandonment your patient. Next is justice is a principle that promotes equal treatment. What is distributive justice is you're giving equal treatment to your patient. Milk, poultry, grain is very good in phosphate. Highlight that. Which patient is having very high phosphate level? Write down renal failure. And what is low here? Calcium. Whenever you have high phosphate, your calcium level is low. Best way to prevent fall, orientation. Orientate your patient. And elderly patient to raise the side rails, maybe they need side rails. Light, write down enough light. Call light in the reach. Take them to the bathroom. Prevent your patient fall. Everyone remember, in NCLEX you might see question, prevention of fall. Are we clear? Now, last 2 pages, I will go through few things, and you make sure you guys know your isolation. Sickle cell really don't need isolation. I want you to cross it out. MRSA is RSV pneumonia. You're going in what? Droplet. Are we clear? Now, MRSA, you're going in, where do you go MRSA? Contact. RSV droplet, pneumonia droplet, pertussis droplet, TB. Where do you put TB? Airborne. Nursing intervention is important to know, underline the word Klein's need. Everyone should know PICC line. And you can give with PICC line medication, you can give IV, you can give TPN, you can draw the blood, you can add there. Make sure nasal spray. When you're spraying nasal, make sure you tell the patient to inhale. If they're not inhaling, your medication is not going to absorb. And clean the nose. Whenever you're putting nose, if you have a lot of phlegm in the nose, your medication is not going to absorb. Blow, clean. Gloves, everyone should know how to wear gloves and remove the gloves. Alzheimer is very high in the exam. What is Alzheimer? Mental changes. What is Parkinson? Shakiness. Are we clear? What do you do in Alzheimer? Orientation, family pictures in the room, calendar in the room. Safety is very important because they walk around and they can leave the building. Alzheimer patients are. Parkinson patients are, we discussed that. Everyone, somebody took the test, has a all question about Parkinson. Are we clear? So I'm telling you, these are the questions you're going to see. Age and child growth and development and thing. Liquid diet. Ice cream is not to liquid diet and also goes in your INO. Bucks traction came in exam. What is a Bucks traction? Skin traction. Elevate the leg. You will see the patient, the leg is up and maybe elevated and the rope is hanging. That's a Bucks traction. I advise you all your picture in Saunders. If I have time, I'll make a copy, but you guys have Saunders book in skeletal system. They have given pictures for all traction. Recognize that, because if they gave the picture and they said, what is this tractions are? And they were asking to recognize. Cleft lip baby. What is the problem in cleft lip baby? Aspiration. Keeping upright. If you're turning, you turn them on unaffected side. Don't let the baby cry. Clean the lip with normal saline and hydrogen peroxide after feeding. Prevent aspiration. So what are you preventing? Don't let the baby cry, because cleft lip is right here. Upright position. If you are turning, you turn them unaffected side. Burping is important. Write down the word burping. Enema. What type of enema? Make sure you're looking in soap, water enema. What is the height of the enema can? 12 to 18 inches. Write down. You can give 1000 cc of fluid. 12 to 18 inches, and you can give 700 to 1000. Temperature. What is the temperature of enema? 105 or body temperature. What do you teach patient when you're giving enema? Take a deep breath and hold it. Internal radiation we discuss, no more than 30 minutes. And strict isolation, right? How far do you stand? 6 feet. ICP, what do you monitor ICP? Level of consciousness. What do you monitor? Second thing, vital sign. What do you monitor next? Pupil reaction, very good. What is Babinski reflex? Positive Babinski reflex. ICP is up. Are we clear? What is Babinski reflex? Fanning of the finger and the toes. Myxedema, we already talked. Hypothyroid. What medication do you give for myxedema? Synthroid. What is the name of the drug? Thyroid hormone. Next page is DKA. Everyone should know. Cast, we talked about it. Crutches, yes. Injury, lumbar. Write down the word is spinal cord injury. What is lumbar? Is spinal cord injury. And the next page. You guys have that page? Mm-hmm. No? You just have one page only? That's it? Do you have this where I'm reading? DKA you have? Oh, okay. So after DKA, cast L7, L2 lumbar, that's your spinal cord injury. We already said Parkinson patients, how should you instruct them to walk? Lift their feet. What do they go? Like this, shuffling gait. Tell them to lift their feet when they're walking. Rheumatic fever. What is rheumatic fever affect? Heart. What part of the heart? Mitral valve. What happened in the brain? Remember the word syndrome chorea. The brain is affected. In the brain, they start shaking. So remember, rheumatic fever affect the heart, affect the brain, and we call syndrome chorea. And on the skin, they have rashes. And the joints are painful. Make sure you know good. You guys wrote it down. And also, antibiotic. What is the reason for rheumatic fever? Streptococcal infection. 18 weeks, 20 weeks, baby should be 80. Where is baby? So what are you monitoring 18 weeks and 20 weeks? Fundal height, right? 20 weeks, where is the baby? Umbilical area, right? Okay. Hepatitis. Hep injection. Mother has hepatitis. Give them hep injection or give them immunoglobulin. Hepatitis mother. Lung surfactant. You give them when they have lung problem, right? Immature lung. How do you manage, check the baby's lung? Write down the word LS ratio. And 1:2 is normal. They are lacking surfactant, so you got to give surfactant. Next is cranial nerve. I gave you in both packages. Remember, 12 cranial nerve, 5 cranial nerve, 7 cranial nerve. At least you all should know. Hepatitis C. What is hepatitis C? Blood. What is so standard precaution. A is your contact precaution. Cushing triad goes where? Write down the word ICP. What is in ICP? Increasing blood pressure, decreasing pulse, and decreasing respiration. So Cushing triad goes in there. Rifampin, you give in your TB medication. Rifampin. Closed drainage system. What is the needle you are inserting in plural? Plural. And closed drainage system, they have some water and they're draining. EEG, we just finished EEG today. What do? Wash the hair and monitor for safety. Cardiac catheterization, check for allergies, right? Before your patient is going. So we finished all the packages, we can stop that. And everyone has